When do you need to approach a doctor for infertility? Infertility is termed when a couple is unable to conceive after unprotected intercourse after a duration of 1 year. Certain factors can reduce the interval from 1 year to 6 months or even lesser when the age of the couple, that is the husband or the wife, is on the higher side, that is somewhere around 30 or 35 plus. Secondly, when there is any history of any disorder that affects fertility, such as tuberculosis, endometriosis, any kind of surgery on the ovaries, or if somebody has taken any kind of treatment related to cancers. Another reason when a couple experiences infertility, if there's any male factor can result in abnormal sperm count or a low sperm count and abnormalities in the structure and motility of sperms. So what are the various tests that one must do? The basic evaluation includes an ultrasound of the female and certain hormonal tests. For the husband, it is important to do a semen analysis because many a times there can be a problem in both the partners. What are the treatment options? If the time interval between marriage and the consultation with the doctor is not very long, basic treatment in the form of ovulation induction can be used. Advanced treatment in terms of IUI, that is intrauterine insemination. If these have already been tried and have not given you a positive result, it is important to proceed for IVF, that is in vitro fertilization. If the basic forms have not resulted in a positive outcome, it is important to proceed for IVF or ICSI. This involves removal of the gametes from the couple's body, making a baby or an embryo in the lab and putting it back into the uterus, which is called as transfer. What are the possibilities that you must proceed for IVF or ICSI at the earliest? If the female has a low ovarian reserve, that means the number of eggs left in the ovaries are less. If there is a severe male factor infertility, if the patient or the couple had any episode of tuberculosis of the abdomen or of the uterus, a severe degree of endometriosis, tubal factors such as tubal ligation or any factor which affects the function of the tubes. In such cases, it is important to proceed for IVF without wasting any time. Another aspect of IVF or ICSI treatment is also something when you are doing fertility preservation. That is, if a person has to proceed for any form of cancer treatment, you can preserve your eggs or sperms by keeping them in the lab, and you can utilize them in the future when your health and all your conditions have been normalized. If you have been experiencing any of the above mentioned complaints, or if there has been a lot of struggle that you're facing in your fertility journey, please visit a gynecologist near you.